Trust for Reaching the Unreached, popularly known as Lok Swasthya Mandal, works in 4 talukas: Halol, Jambugoda, Gogamba and Kalol in the rural tribal district of Panchmahals in Gujarat to provide community-based mental health care. We present a series of short videos depicting various aspects of TRU's community mental health program. We hope this will help other health-focused NGOs to initiate community mental health programs in their own areas. In the first video, we got an overview of mental illness and described the need to bring awareness and treatment of mental health problems in the communities. In this video, Chapter 2 of the 6-part series, we will look at some of the ways by which we identify mentally ill patients through our program. Early identification and early treatment are critical steps in the long-term care of patients with chronic and debilitating diseases. However, patients with mental illnesses are not easily found in the community. Those who suffer from common mental disorders do not report to health services unless their problem becomes hard to cope with. Patients with severe mental disorders are either hidden away in their homes and typically absent from community events, thus making it hard to identify them. It becomes an intense search for even our community health workers to find these patients.
Our community mental health workers are members of the same or similar communities as the patients. They are enthusiastic young persons who may or may not have a highly qualified educational background, but they understand and know the community very well. So they are socially and culturally well accepted, and they are specifically trained to carry out various tasks in mental health. We have developed an easy to understand symptom checklist that the community mental health worker uses to identify a mentally ill patient. The symptom checklist allows us to know most symptoms of mental illnesses, and here we have tried to simplify the approach to mental illness. We do not aim at diagnosing the kind of mental illness, but we do determine if the person needs psychiatric help or not. The final decision about the patient is left to the psychiatrist, who is using the DSM criteria to label the kind of illness.
Symptoms are divided into groups to denote the types of changes in a person's thought and behavior. These changes are used to determine if the person is suffering from mental health problems. If the patient exhibits 2 or more symptoms persisting for more than a month, then the patient is referred to a psychiatric clinic. Let us now explore this checklist in greater detail. Changes in behavior that are socially unacceptable and/or are mocked by the community. Change in ability to converse and communicate is easily identifiable. To determine changes in emotional states, which are typically difficult to identify, we have listed symptoms that can be observed by the worker, such as feeling of pain, fear, happiness, and others. Hallucinations, auditory or visual, are 2 major symptoms that the worker has to recognize, as these symptoms are misconceived by the community. When young students find it difficult to remember or learn school lessons, that is frequently reported by their parents as evidence of mental problems in their children. However, it is important to know if the complaint really needs psychiatric treatment or not. Such cases are discussed and decided in the review meetings before the person is brought under treatment. Loss of orientation about time, location, and people is difficult to identify. But our workers are taught to recognize these symptoms by asking specific questions while taking the history of the patient. Interruption in personal hygiene, socialization, and economic activities are reported by the family if they know that these symptoms are of illness.
Sleeplessness, aches and pains, not feeling hungry, headache, etc. are also important symptoms. But these complaints are discussed in our review meetings whether the person suffering from any of these should be put to psychiatric treatment or not. effort is also to train the mental health workers to differentiate between physical and psychiatric illness. Our community mental health worker is explained each part of the symptom checklist and trained how to use it in the community. They visit families of the people in the villages and read the checklist aloud in every home. Though we have observed a mixed response from the community. Some people hide the fact that they have a patient in their homes, but some readily understand and talk about the patient in their homes.
TRU also organizes health awareness programs in the community to promote the identification of patients. TRU sensitizes the government health cadres such as accredited social health activists or ASHA, Anganwadi workers, auxiliary nurse midwives, multi-purpose health workers, and also the medical officers of primary health centers through personal contacts and through educational materials and training programs. The village leaders like Falia Agavans, the Panchayat members, the dairy members, the shopkeepers, and others also help in identifying the patients. The local school teachers, high school going students, and other youth are also looped in for the identification work. The patients identified with the help of the symptoms checklist are categorized according to their symptoms. There are weekly data review meetings where the list of newly found patients is discussed in the presence of the coordinators of the program. There is preliminary ruling out of the presence of diseases other than psychiatric disease. During this review, those patients who are not likely to be suffering from mental illnesses are listed separately, and the community mental health worker is advised to refer them to the general medicine outpatient department. For those who are likely to be suffering from mental illness, the health worker is advised to refer them to the mental health clinic where they are finally diagnosed as mentally ill by a psychiatrist.
We have made an effort to identify each patient, each mentally ill person in the community, and the community mental health worker plays a key role in this process.